How does a patient learn about all these procedures and tests before they go to the hospital? Because many don't know.
I mean, I could make the argument maybe they shouldn't know, in the sense that, you know, sometimes a little too knowledge. You know, the reality is, remember, it goes back to our original segment where we said what drives people to go to the emergency rooms, because most people go without real major emergent problems. It's the uncertainty. So you know, the uncertainty of what do I do, what is this test, what am I going to get, what does this pill do, the more we in the medical establishment can define this is what it is and this is what you need, this is what you don't have, the better. So the reality is, you know, an individual doesn't have to know the intricacies of a catheterization. They should have some general idea of what it is in case they need it. They're going to be consented. No one's going to do any of these things without the person or the family member that's being responsible aware of what's going on. But, you know, I think I won't say there's damage in information, that's not the case, but there's certain levels of information that you want to have confidence in your medical providers of, and certainly you can do your due diligence to make sure that the providers are competent, the hospitals have good outcomes in terms of, you know, people walking out of the hospital on 2 feet. I think that certain things like stress tests, EKGs, yeah, those are things people should be aware of, only because they're so much more common and so much more likely to be exposed to those types of things. So that's why you want to make sure, is this really the test for me? Do I really need this? Even provoke it sometimes. Hey, listen, shouldn't I get a stress test? Because sometimes, you know, there's a dialogue in what tests should be done. I don't know, that's my opinion.